focus assessment. My name is Rosa Brenes, and I have a blank sheet of paper. Hello, my name is Rosa, and I'll be your nurse practitioner student for today. What is your name?
Richard,
How old are you?
45,
When's your date of birth?
8172.
Okay. And do you consent to this video exam?
Yes.
Tell me what brings you into the clinic.
Have nausea, vomiting, and diarrhea.
And for how long have you had this?
About 2 days.
About 2 days. Are you having any pain anywhere?
Abdominal cramping.
And how many times a day are you vomiting?
Vomiting 3 to 4 times a day.
Okay. And what about the diarrhea?
About 5 to 6 times a day.
And your vomit, what color is it?
It's like a bile color.
What about the diarrhea?
It's really watery.
Have you, is there anything that makes it worse?
When I eat or drink anything, even water.
And have you tried anything to make it better? Like, have you taken any medication? No. And when did you notice you started having this nausea, vomiting, and diarrhea? Was it like, it just was onset, or was it after you ate something?
Yeah, it was after I ate some baked chicken. I think it was baked chicken that I ate a couple days ago, and within an hour or so of that, I had to go.
All right, let's talk about your current health history. Are you taking any medications now, like supplements, vitamins?
No.
No. Okay. Do you have any allergies to any drugs or foods?
No.
When was your last physical exam?
January of this year.
January of this year?
2018.
And all your immunizations up to date?
Yes.
Your flu shot? You
Yes.
got that too? Yeah. Let's talk about your past medical history. Have you had any illnesses or trauma?
No.
What about any hospitalizations or surgeries?
I've had 3 surgeries on my right wrist, and I had a tonsillectomy when I was about 15. So that was what, 1987 for the tonsillectomy, and 92, 2009, and 2017 for the wrist surgeries.
Okay. Are you sexually active?
Yes.
Okay. And are you using protection?
No, I mean, I have a girlfriend for the last couple of years, so.
Okay. When was your last HIV check?
About 2 months ago.
2 months ago. Any emotional or psychological history? No. So tell me a little bit about your family, about your mom, if you have your dad, any siblings,
Tell them about.
like medical history.
Okay. Well, I don't know who my dad is, so I never met him, so I can't say anything about him. My sister is healthy as far as I know. My mom, I know, has OA, and she has PDD, I think it is called.
Okay. Let's talk about your social and personal history. What race are you?
African American.
Okay, and who do you live at home with?
I live just me and my dog.
You own the home?
Yes.
Do you use tobacco or any smokeless tobacco products?
No.
What about drink any alcohol?
No.
Do you illicit drug use?
No.
And how would you say your diet is?
Well, I try to eat healthy when I can.
So tell me, how are you feeling today? Are you getting enough sleep due to this? Nausea,
Um,
vomiting,
no, I'm,
diarrhea?
I haven't really been sleeping that great, just because it's uncomfortable and I have to go to the bathroom in the middle of the night. So I nap. I've been napping.
Okay. And have you had any weight loss or weight gain? No. Okay. Let's talk about like your heart. Are you having any shortness of, any chest pain, any reflux,
No.
any edema in your lower extremities?
No.
Let's talk about your respiratory. Are you having any like shortness of breath, difficulty breathing when you do activities?
No.
No. Do you have a cough or anything any blood in your cough?
No, definitely not.
Okay, for your are you having like a sore throat or anything like that? No. Are you having any difficulty urinating?
No.
And for the vomit, do you see any blood? No, no blood. What about for your the diarrhea? Do you see any like black tarry stools? Any blood?
No.
Have you had any trauma to the abdomen or any like liver disease?
No.
Have you traveled outside the country recently?
No.
Okay, so I'm gonna do an exam on you. Okay, I'm gonna step out for a minute. I just need you to take off your shirt.
Okay, I'm ready.
All right. Let me wash my hands real quick. All right, the first thing I'm gonna do is I'm gonna listen to your heart, okay? I'm listening to the heart using the diaphragm. I'm going to the right second intercostal space to the aorta. Now to the pulmonic. Herb's point. Tricuspid. And mitral, the point of maximum impulse. I'm going to check the heart rate. I have 76. No more rate and rhythm. Now I'm going to switch to the bell. And I'm going to check for any murmurs. At the same spot. Aortic. Pulmonic. Herb's point. Tricuspid. And mitral. Okay, next thing I'm going to do is I'm going to check your respiratory system, listening to your lungs. Okay. I'm we'll start at the apex with the diaphragm. Take a deep breath. Deep breath. Okay, and then go ahead and lift your arms up. I need you to take deep breaths again. Okay. Now I'm going to take a look at your back and listen to your lungs from the back. Okay, I need you to turn this way. Sit right here. And then kind of just lean a little bit. All right. I just need you to breathe in normal, okay? Go ahead and take a deep breath. Okay. Okay. All your lung sounds are clear. All right, go ahead and lay down. And I'm going to do an abdominal inspection. So I have a light here that I'm going to be using to inspect for any pulsation, abnormal pulsations or any abnormal skin discoloration or in the umbilicus. So I have to get at eye level. Okay, and then inspect the umbilicus for any deformities, protrusion. Okay. And then I'm going to check for symmetry. Okay. All right, next thing I'm going to do is I'm going to listen for the vowel sounds in the 4 quadrants. Versus the right lower quadrant using the diaphragm. Then the right upper quadrant. And then the left upper quadrant. And the left lower quadrant. And then I'm going to do it over the liver for any vascular sound. And over the spleen with the diaphragm. Okay. Next thing I'm going to do is I'm going to switch to the bell and listen in the epigastric region for vascular sound. And then in the umbilical area. And then I will also listen to the aorta with the bell. Renal arteries on both sides. For any abnormal vascular sound. The iliac artery. And then also the femoral arteries with the bell on both sides. Okay. And the next thing I'm going to have you do is I'm going to have you take a deep breath and hold it so I can listen at in the gastric bubble. I'm going to be using the diaphragm for that. Take a deep breath, hold it. Okay. Breathe normal. Next thing I'm going to do is I'm going to percuss in your abdominal area, all the regions. And then we're going to do the liver measurement, the liver scan by percussing. And then we're going to start from the hospital area and down. And then we're going to measure it. It's going to be 9.5 centimeters. Next thing I'm going to do is you're going to take a deep breath and I'm going to palpate, percuss over the gastric area. Okay, ready? Take a deep breath. Hold it. Okay. Hold it. Then I'm going to percuss over the liver. And then the spleen. Okay. The next thing I'm going to do is a light palpation in all the abdominal quadrants. Let me know if you have any tenderness or pain. Okay. Next I'm going to do is moderate palpation. Then I'm going to palpate for the liver. And the spleen. Okay. And the next thing I'm going to do is deep palpation. This might hurt a little discomfort.
Yeah, it's not powerful. It's just depressing. That's all.
All right, and we're going to palpate for the liver. the gallbladder and the spleen. You can try to palpate for the kidneys through the front. Sometimes it may be difficult. Okay. And then I'm gonna palpate for the aorta. Then we're gonna check for abdominal reflex. Make sure the muscles are. All right, go ahead and sit up, and I'm gonna check the kidneys. This way. Okay. So we'll check. Okay. Okay. All right, and that's our exam. Thank you.
Thank you.